Hi everyone, I'm Brian Argenti from B Screen 2B. My topic assigned is all about crime. Crime define crime, examples of crime, reasons for committing a crime. So, what is crime? A crime is an unlawful act punishable by a state or other authority, the intentional commission of an act usually deemed socially harmful or dangerous and specifically defined, prohibited and punishable under criminal law. Examples of crime reasons for doing a crime. Examples: killing another person, sell contraband such as guns and illegal drugs, injuring another person or stealing from another person, violence and sex, and last is discrimination. Reason why do we commit a crime: greed and anger, jealousy, revenge, or pride. So kana ko ng pride sa katao. Other commit on impulse out of rage or fear. The desire for material gain, money, or expensive belongings lead to property crimes such as robberies, burglaries, white-collar crimes, and auto thieves.
So my topic is all about crime and punishment, a biblical perspective. So here's the part. In particular, with the biblical form, the biblical possession, crime is caused by evil of men's heart, only men's heart. Then the Lord saw that the wickedness of man was great on earth, and that intent of the thoughts of his heart is only evil continually. So it continues that his intentions is only evil. And then next is the demonic possession, possessed by malevolent preternatural beings referred to demons or evil. So this basically this best explains that a man that commits a crime means that he possesses an evil spirit.
So hello everyone. I explain about the Catholicism. So Catholic exorcist differentiate between ordinary satanic demonic activity or influence mundane everyday and temptation. An extraordinary satanic demonic activity which can take six different forms ranging from complete control by Satan or some demons or voluntary submission first. So possession in which Satan or some demons take full possession person's body without their knowledge or consent, victim therefore morally blameless. So, second is obsession, which includes sudden attacks and irrationally obsessive thoughts, usually culminating in suicidal ideation and typical influence dreams. So third is operation in which there is no loss consciousness or voluntary action such as a biblical book or love and job as tormented by a series of misfortunes in business, family, and health. So, fourth is external physical pain caused by Satan or some demons. So, fifth, invasion which affects houses, things, and animals. So, sixth, and of subjections in which persons voluntarily submit Satan in demons. So, ani kay moral magdepende sa imong batasan kung magkuan ka sa imong pagkabati na batasan or side ka sa demon or sa evil at demon or sa angel. So which means nang ganahan ka ba or good or unbad. So that's all. Thank you.
So the next topic is the causes of crimes in medieval period. The most common crimes in medieval period would be very recognizable to the people. These causes of poverty and therefore of crime were constant throughout the medieval period, even up to the industrialization of the early 19th century. Treason was seen as one of the worst crimes by all, and it was the charge that each medieval person feared most. Despite this, many people were charged with treason. Retribution and deterrence were the main attitudes towards punishment in the 16th and 17th century. They led to harsh punishments where the criminal suffered pain, humiliation, and even death. Even the Catholic Church used torture and imprisonment to obtain confessions from people regardless of whether they are guilty or they're not. Medieval castles had a built-in prison known as a dungun, so I guess you're familiar with it kaya makitaan ginaturo sa ubang salida. People were normally locked there if they had committed treason or if they will betray the king, of course. But there were many of other gruesome punishments for criminals and traitors, and many took place in public to scare potential criminals. So, kasagaran sa ilahang mga punishment kay publicize gina siya kay aron makaingon ng mga tao nga di ko ni buhaton kay kuan basig mapareha ko inana nga patyon ko atubangan sa mga tao.
So let's start with classification of criminals by Cesare Lombroso. First is born criminals, which is in this theory, it suggests that criminality is inherited. So katong mga person nga born criminals kay they are identified through their features, physical features. So example like kanang they have hook like nose, bloodshot eyes, or pulay lang mata. So kani silang pailhanan nga usa ka tao kay born criminals siya. So this is according to Lombroso's theory. So next is atavistic form. So features of the thief, expressive lang face, manual dexterity na which means kana mga tao nga maayos kayo sa mga butang nga kamutrang gamit. Next is small wandering eyes. So next features of the murderers, which is cold na grassy lang stares. Yeah, pula ilang mata o big hook like ilang nose. So features of sex offenders, which is example kay rapists, bagay lang lips na nakaprotrude ilang ears, protruding ilang ears. So features of women offenders kay shorter sila, more wrinkled na baga ilang, darker ilang buhok, smaller lang skulls kontra sa normal women.
So my assigned topic is violence related to accusation. So una, ato sang i-identify unsa ng violence ug ang accusation. Ang violence diay kay is a form of aggression such as assault, murder, o rape. Yang accusation diay kay mao na siya ang charge of wrongdoing or sa Bisaya pa na masangil. So nganong na-relate man ang violence ug accusation? It is because belief in witchcraft continues to be present today in some societies. An accusation of witchcraft are the forms of violence including murder. Because sa una man god, if maakusahan ngay ka nga witch ka or witch ang usa ka tawo, kay prisuhon, ikaw magpriso, torturon, ikaw magtorture, patyon. Pero kaning accusation kay violence against women siya. Because if moingon ganit tag witch, ang mahunaw naa nato kay mga babayi. For example is in Tanzania, about 500 older women are murdered each year because of accusing them of being a witch. Sa Tanzania daw kay kinintos kabuk babae nga tiguang patyon taga-tuig because accusing them of being a witch. Mao na ang violence ug accusation na relate to each other. Thank you. So, my assigned topic is criminal by passion. What is criminal by passion? Criminal by passion is a crime committed while in a throes of passion with no opportunity to reflect on what is happening and what the person is about to do. So, kanidang criminal by passion, mo ni siya ang crime nga wala nakakabalo sa imong buhaton because of rage, sa kalagot, or sa selos. For example, ani is a husband who discovered his wife in bed with a lover and who attacks and kills the lover in a blind rage has committed a crime of passion. So kanida yung banda day na nakasakop siya nga yang asawa naikaana moto tungod siyang kalagot or kasilos wala siya kabaw siyang buhaton napatay niya yang asawa og ang laki siyang asawa. Mo ni siya ang example sa crime of passion. Thank you.
Classification of criminals by Cesar Lombroso in Great Emotion. There are many positive emotion, positive feelings that people can express or can feel. And understanding those positive feelings is very important to every individual. So according to Cesar Lombroso, ang usa ka tawo makakommit ko og crime because of his or her great emotion. So kung di niya ma-control or di niya ma-understand ang iyang mga emotions, ang mga feelings, so dako chance nga makakommit siya og crime.
So, positive feeling are one of the core elements to have in one's life to enjoy well-being and happiness. So, ang kana kuno positive feelings and mga emotions, dapat kuno nga ma-understand sa usa ka tawo para malikaya niya or dili siya mapaduol nga makomit og crime. So, unsa man na nga mga positive feelings. So, these are the top 20 positive feelings nga dapat sabtan sa ma-understand sa usa ka tawo and iyang ma-feel. So, ang first is joy, interest, serenity, hope, gratitude, kindness, surprise or pleasant, confidence, admiration, enthusiasm, euphoria, satisfaction, pride, contentment, inspiration, amusement, enjoyment, awe, love, and cheerfulness. So, mao to ang mga top 20 nga positive feelings nga dapat ma-understand and ma-feel sa usa ka tawo.
So good day, I am John Cliff Rimutan, and today I'll be discussing the classifications of criminals by Lombroso. So number 4 is like anger. So like anger is anger or wrath is emotion characterized by antagonism towards someone who has deliberately done you wrong. So anger can be a good thing, but excessive can cause problems. For example, difficulty to think straight and may harm you or other person. So example is kana magtabi mo between sa imong Ayla. So sa iyang Ayla is direct tagging na niya. Bibuang nga to ba yung sa may pangitabuha ba nga ni siya. So mo to gibalik-balik niyang mastorya. So syempre ikaw mo offend ka sa iyang pantabi. Imo badlongon so buang nga ni nasuko ka. Buang nga ni ba nga hagper mo na human siguro balik-balik ana. Makapikal man kay. So wala. Next, there are two types of anger disorders. The first is passive anger. So passive anger is people experiencing passive anger may not even realize they are angry. When you experience this, your emotions may be displayed as sarcasm or apathy or meanness. So, example is ka na mga libakira. Libakira, di ba, ang silingan na to, usahay ka na masilingan na to nga. Sa atong pag-asinso kay mapikal sila apil. Atong pag-asinso, ilat na libak nga na, buang nga, mga niyo sa kay trabaho na nila. Nga asinso na sila, wala sila pangita. So second is aggressive anger. So aggressive anger is individuals who experience aggressive anger are usually aware of their emotions, although they don't always understand the true roots of their are. So gini, example na is ka na mga direkta makasuko, pakita ni mga so like mga samba ka nga kanya sa inabuhat, buang nga nimo mo na higid kag mo na udagmalan ana. So causes of anger. So causes of anger is that environment. So environment is an example is kanang squatters area. So squatters area is kuan mangina basically langas mangina siya. Langas niya. Gusto ka mo-chill. So langas di comes na sigaway-away di akyat kay mga bata mo na. Siyempre masuko ka, gusto mo chill masuko ka. So second is stress. Stress is kapoy kaysa gusto kayong relax pahuway na niya. Tagon ka, hoy, hoy, Juan kanang tingwan ni dire, tingwan ni mga trabahoon dire. Ya, ikaw gusto na mo. So, buang nga ka na di siya di. Kana di ako kinayong buta yung manghod si Pedro. Kana si Pedro di, wala mo siya gibuhat di. Muna. Ako, ganin na rin mo na. Subay-subay na. So, third is financial issues. So, financial issues is that sample kay kwarta. Kung magiging kwarta niya, na ay palitunon niya. Di ba kakapalit yung kay kwarta. So, muna, mag-rigor na yung auto. Mangita na usa kaya akong buhat ng parang kwarta ko dayon. Mana nakayasawa yung asawa, uy wala tay bugas niya buang nga ka rin ako nangita kayo paagi para makakwarta so second the fourth is abuse. So abuse ka is kanang example nagmalan ka not only physical but kanang mental. So nasikaan ka pasakitan ng storya duot sa bukog. So syempre imong kasi mugna to nang tumang ka kasuko dito yung mao na nga wala makasuko si mo na una nga lain na nila mo na sa mo na magtanong ka suko. So last poor social or familial situations. So sa poor social or familial situations that dili ka bitaw sociable, dili ka hing barkada ana. So imong giunana imo ligin ka ugalingon, dili ka open sa ilaha. So I think with that's it, and thank you.
So next is the insane criminals. It is a term describing intellectually and morally challenged or defected individuals, such as psychopaths and habitual delinquents. While the person had committed crimes, while being acutely bewildered by their insanity, is called the criminally insane. So, for example of this is while you're walking, someone stabbed you without reason. So another example is assassination. Para ma famous ing ana bitaw nga ilang ilang mindset pirmi is ma famous bisag sala na ang nakuan, imo nang na kuan ang mga laws ngana. So ang kaning insane criminals is legal legal defense by a criminal defendant to avoid being convicted by a crime. So mao ning ilang pasangil sa uban nga nabuang sila para dili sila mapriso. So that's all.
My topics are about psychological disorder, and psychological disorder, also referred as a mental disorder, are the abnormalities of the mind may result in a persistent behavior patterns that can be seriously affect your day-to-day function and your life. So unsa di ang psychological disorder? So mao ni siya ang kanang psychological disorder, mauna sila kanang mga tao nga nay mental illness, kanang makakuan kanang mga nay sakit sa utok ba na like makasinati og depression. So mao na sila. So the specific causes of the psychological disorder are not known, but contributing factors may include chemical imbalances in the brain. So mao to akong ingon ganiya, childhood experience, heredity, illness, prenatal exposure, or kanang stress. So sunod, what are the symptoms of the psychological disorder? So unsa may kanang kasagaran nga symptoms ana niya? So symptoms of psychological disorder may vary based in the specific disorder, but mood and behavioral symptoms are common. Symptoms can be chronic and relapsing. They can be interfere with your ability to interact in the society. Some psychological disorder can be also cause physical symptoms. Lord.
Good day everyone, my topic is all about neurodevelopment disorder. Psychological disorder is typically diagnosed during infancy, childhood, or adolescence. So best example of this is Sibudoy. Sibudoy is naa siya mental illness. Another example of neurodevelopmental disorder are intellectual disability, referred to as mental retardation, global development delay, development disabilities in children under age of 5, communication disorder that affects an individual's ability to comprehend, detect, or apply language and speech to engage in discourse effective with others. Autism spectrum disorders, conditions related to brain development that impacts how a person perceives and socialize with others, causing problems in social interaction and communication. Attention deficit, chronic condition that affects millions of children and after continues in adulthood. So, neurodevelopment disorder dali ra kay siya ikuan kay from the word neuro, which means brain, sakit sa pangutog bitaw na something like that in ana. So that's all for today. Thank you.
Hello everyone. So let's talk about bipolar and related disorders. So bipolar disorder is characterized by shift in mood as well as changes in activity and energy level, experiencing shift between elevated moods to periods of depression. So that is bipolar disorder. There are two types of bipolar disorder. One of these is mania. So mania is characterized by feeling overly excited and even hyper. Periods of mania is feeling of distraction, irritability, and excessive confidence. So the second ones of the bipolar related disorders is depressive episodes. So depressive episodes are characterized by feeling of intense sadness, guilt, fatigue, and irritability. So they will lose interest in activities they previously enjoyed. They will experience sleeping difficulties, even have thought of suicide. So this is the opposite of mania. Both manic and depressive disorders episodes can be frightening, for both the person experiencing these symptoms as well as the family, friends, and other loved ones. Fortunately, appropriate and effective treatment such as medication and psychotherapy can help people successfully manage their symptoms. So if we have friends na naiinani nga mga sakit, kailangan tabangan nato. Kailangan kabalutan sa atong buhaton. Thanks.
So good morning everyone. The next topic is anxiety disorder. An anxiety disorder is a type of mental health condition. If you have an anxiety disorder, you may respond to certain things and situations with fear and dread. You may also experience physical signs of anxiety such as pounding heart and sweating. Anxiety is a problem when it becomes overwhelming or unmanageable and it becomes unexpectedly. Anxiety disorders are mental illnesses that have a big impact in your life. People with this disorder will try to avoid the situation or endure it with a great anxiety. So the most common signs and symptoms are the extreme fear of public speaking, meeting new people, eating or drinking in public. Antisocial personality disorder or APD is one such diagnosis that is widely and arbitrarily applied to many in the prison population. The insanity defense, also known as the mental disorder defense, is an affirmative defense by excuse in a criminal case. So, munay ilang giingon nga walay sala ang buang. Arguing that the defendant is not responsible for their actions due to an episodic or persistent psychiatric disease at the time of the criminal act. But there are some cases no nga mapriso gid siya. But there are some certain cases in which a mentally ill individual who commits a crime will sent to prison or tagaan siya special treatment.
Trauma and stressor-related disorder. Trauma and stressor-related disorders are a range of mental and behavioral issues that can arise as a result of traumatic or stressful childhood events. Exposure to physical or mental aggression or pain, such as abuse, neglect, or family strife might be among these traumatic and stressful events. Trauma and stressor-related disorders involve exposure to a traumatic or stressful event. Two of the trauma-related disorders are acute stress disorder and post-traumatic stress disorder. Acute stress disorder and post-traumatic stress disorder are similar except that acute stress disorder typically begins immediately after the trauma and lasts from 3 days to 1 month, whereas post-traumatic stress disorder lasts for 1 month, either as a continuation of acute stress disorder or as a separate occurrence that begins up to 6 months after the trauma. Previously, trauma and stressor-related disorders were considered anxiety disorders. However, they are now considered distinct because many patients do not have anxiety but instead have symptoms of anhedonia or dysphoria, anger, aggression, or dissociation. Coping with traumatic stress. First, lean on your loved ones. Identify friends or family members for support. Second, face your feelings. It's normal to want to avoid thinking about a traumatic event. Third, prioritize self-care. Do your best to eat nutritious meals, get regular physical activity, and get a good night's sleep. Be patient. The last one is be patient. Remember that it's normal to have strong reaction to a distressing event.
Dissociative disorder. So what is dissociative disorder? Dissociative disorders are psychological disorder that involves a dissociation or interruption in aspect of consciousness, identity, memories. So, dissociative disorder includes the following. Dissociative amnesia involves a temporary loss of memory as a result of dissociation in many cases. This memory loss which may last for just a brief period of many years. It is a result of some types of psychological trauma. While dissociative identity disorder, or formerly known as multiple personality disorder, involves the presence of two or more different identities or personalities. So, in dissociative identity, this involves the presence of two or more different identities and depersonalization. Depersonalization or derealization disorder is characterized by experiencing a sense of outside of one's own body and being disconnected from reality. That's all.
The somatic symptom disorder. So, somatic symptom formally referred to somatoform disorder, a class of psychological disorders that involves prominent physical symptoms that may not have a diagnosable physical cause. It is also a form of mental illness that causes one or more bodily symptoms, including pain. And the example of this is fever, fatigue, and vomiting. So, what caused the somatic disorder? Psychosomatic illness aggravated by emotional stress and manifests in the body as a physical pain and other symptoms. Depression can also contribute psychosomatic illness, especially when the body immune system has been weakened by severe or chronic stress. So, somatic symptom disorder involves a preoccupation with physical symptoms that makes difficult to function normally. These preoccupation with symptoms result in physical distress and difficult coping with daily life. It is important to note that the somatic symptoms do not indicate that the individual is faking his or her physical pain, fatigue, or other symptoms. In this situation, the actual physical symptoms that are disrupting the individual's life as it is extreme reaction and resulting behavior. So, we all know that a lot of us encounter someone who's always saying that my head is aching, I am not feeling well, or very stressed about school and works. We tend to say that maybe he or she is just pretending. For example, ako self, di man jud nako malikayan ma-stress, ma-over fatigue like sa akong schoolworks tapos na pay mga buhatonon sa balay and then mo ana ko sa akong mama nga labad akong ulo na need help tas ang response sa atong mama kay pag sige pagduha or atubang anang mga sipin nimo or like chuchu pa nimong gibuhat dra like ambot lang anong inana sila. So these situations really explain of having a somatic symptoms which ato rang gibaliwala usahay and it is not a good idea. Kay basig or more grabe nga mo lead na into depression and anxiety. Margin that's all my topic.
Is feeding and eating disorder. So, eating disorder are characterized by obsessive concern with weight and disruptive eating patterns that negatively impact physically and mental health. Feeding and eating disorders that used to be diagnosed during infancy and childhood have been moved to this category in the DSM-5. So this is our types of eating disorder. Anorexia nervosa is characterized by restricted food consumed that leads to weight loss and a very low body weight. So mano yung pagtanaw siya og lingon sa amin. Daot tambok siya pero sa personal day daot siya. So next is bulimia nervosa involve binging and taking extreme step to compensate for this binge. This compensatory behavior might include self-induced vomiting, the abuse of laxatives or diuretic, and excessive exercise. So, na siya pag magtago-tago kaon na yan na kang ganahan. So, rumination disorder is marked by regurgitating previously chewed or swallow food in order to either spit it out, or re-swallow. Most of those affected by this disorder are children or adults who are also have a development delay or intellectual disability or maglisod og swallow ingana sige rag nguya. Then pica involves craving and consuming non-food substance such as dirt, paint, or soap. The disorder most commonly affects children and those with developmental disability. Morning mga bata karon kay usaon na kay mukaon na ibang klase nga kon pareha ng lapis sila kanon hantod mapudpud or mga bisag unsa pa na mga mao na ang dili maayo. So, and the last is binge eating disorder was first introduced in the DSM-5 and involved episode of binge eating rating when where the individual consume unusually large amount of over the course of a couple hours. Not only do people overeat, however, they also feel as if they have no control over their eating. Binge eating episodes are sometimes triggered by certain emotions such as a feeling happy or anxious by boredom or following a stressful event. So that is all about my topic. So mao na yung example na ni kanang pasagad drag kaon hantod man makita ka ng tambok ay na siya. Hindi naman niya mapigilan na sige kaon. Taga every minute or kaon na sad. That's all.
Sleep-wake disorder. Sleep-wake disorder is a sleep-wake disorder involved problems with the quality, timing, and amount of sleep, which result in daytime distress and impairment in function. Sleep-wake disorder often occur with the long condition, other mental health conditions such as depression, anxiety, or cough disorder. What is the causes of the sleep-wake disorder? Sleep-wake disorder occur when the body internal clock does not work properly. Next. What are the different types of sleep disorder? There are many different types of disorder. Sleep insomnia, sleep apnea, parasomnias, restless leg syndrome, narcolepsy. There are the types of disorder. How are sleep disorder diagnosed? Your doctor will first perform a physical exam and gather information about your symptom and medical history. How are sleep disorder treated? Treatment for sleep disorder can vary depending on the type underlying cause. However, it generally includes a combination of medical treatments. To lifestyle changes, adjustment can greatly improve your quality of sleep, especially when they done along the medical treatment. The basically kanang mas nindot is you need to go to sleep early para mo nindot ang dagan sa imong life changes. While you might be tempted to sleep in on the weekends, it can make it more difficult to wake up and fall asleep during the work week.
This topic is disruptive impulse control and conduct disorders. Disruptive impulse control and conduct disorders refers to a group of disorders that include oppositional defiant disorder, conduct disorder, intermittent explosive disorder, kleptomania, and pyromania. This disorder can cause people to behave angrily or aggressively towards people or property. Problematic behaviors and issues with self-control associated with this disorder are typically first observed in childhood and persist into adult. In general, disruptive impulse control and conduct disorders tend to be more common in males than females, with the exception of kleptomania. That's all.
Substance-related and addictive disorders. So, psychoactive substances have been used by people in almost all cultures since prehistoric times. Psychoactive substances affect brains. So we have two groups of substance-related disorder, which is substance use disorder, dependence, and abuse. Substance-induced disorder is intoxication and withdrawal. So we have example of substance-related disorder, which is alcohol. Using alcohol and drinking too much can affect your mental health, physical health, and relationship. And we have cannabis. Refers to a group of three plants with psychoactive properties known as Cannabis sativa, Cannabis indica, and Cannabis foederale. So cannabis, so it is a kind of drugs that can use for medication for other country, but it is illegally. So inhalants, it is common inhaled substance include glue, thinner, rugby, volcacil, gasoline, volatile solvents, etc. So kanang masimot na to. So stimulant, it is a new category now found in the DSM-5 that involves the use of stimulants such as methamphetamines and cocaine. So this type of substance, it is a chemical or substance that affects the behavior, mind, and body of the people who misuse of it. So this DSM-5 also include gambling disorders. Under this classification, the American Psychiatrists Association explained that this change reflects the increasing and consistent evidence that some behaviors such as gambling activate the brain reward system effects similar to those of drugs of abuse, and that gambling disorder symptoms resemble substance use disorder to a certain extent. So that's all, and thank you.
Neurocognitive disorder. So what is neurocognitive disorder? Neurocognitive disorder are characterized by acquired deficits in cognitive function. These disorders do not include those in which impaired cognition was present at birth or early in life. Sumunod siya ang brain injury, neurocognitive disorder due to traumatic brain injury. So, brain tuwan ng tuhan ng utok. Yeah. There are types of cognitive disorder. First is delirium caused by withdrawal from drugs, infection, brain injury, or tumor. Then the treatment is shown familiar personal belongings, help deal with anxiety, agitation, hallucination, etc. The second is mild neurocognitive disorder. Early stage of cognitive decline can continue to function independently. So, example niya kay kaning agonisya, inability to recognize a name, object. The second is spatial agonisya, inability to recognize faces, even familiar ones. And lastly, the major neurocognitive disorder, dementia, for example, gradual deterioration of brain functioning, affecting memory, judgment, language, and etc. Also, the Alzheimer's disease can't integrate new information, learn new associations, forget important events, lose object, love interest, are socially isolated. That's all.
My topic is all about personality disorder. So, what is a personality disorder and what causes it? Personality disorders are caused by a mixture of genetic factors, such as a family history of disorders and upbringing. People who have a dysfunctional home life in early childhood and adolescence can develop personality disorders in later life. So, which means that it exists when these traits become so pronounced, rigid, and maladaptive that they impair work and or interpersonal functioning. For people with personality disorders, unlike many others who seek counseling, the distress caused by the consequences of their socially maladaptive behaviors is usually the reason they seek treatment, rather than any discomfort with their own thoughts and feelings. Thus, clinicians must initially help patients see that their personality traits are the root of the problem. Once clinicians suspect a personality disorder, they evaluate cognitive, affective, interpersonal, and behavioral tendencies using specific diagnostic criteria. More sophisticated and empirically rigorous diagnostic tools are available
for more specialized and academic clinicians. So, I have a two types example of personality disorders: borderline personality disorder and avoidant personality disorder.
The criminaloid. A criminaloid from the word criminal and suffix oid, meaning criminal-like, is a person who projects a respectable upright facade in an attempt to conceal a criminal personality. This type first defined by Cesar Lombroso in the later edition of his 1876 work, The Criminal Man. Unlike ordinary criminals, criminaloids enjoy the respect of society, and because they often establish connection with the government and the law, they are less likely to meet with opposition due to their respectable standing. They generally enjoy greater prosperity than the average criminal and have an automatic advantage over their more conscientious colleagues. And the key to the criminaloid is not evil impulse but moral insensibility. The criminaloid prefers to prey on the anonymous public. He goes to beyond this by convincing others to act instead of acting himself, which protects him from liability and being labeled a criminal, and is instead immune to such scrutiny. The criminaloid practices a protective impersonation of the good. The criminaloid counterfeits to good citizen. Thank you.
So my topic is less self-control or lack of self-control. So, less self-control or lack of self-control is the inability to restrain one's emotion, desire, or impulses. So, people who lack self-control are more likely to be involved in impulsive behavior and emotions. This implies they're more likely to make poor decisions that injure themselves or others. Lack of self-control can harm your self-esteem, education, career, finances, relationships, and overall health and well-being, just as it can help you achieve your goals and improve your physical and mental health. So it is important to learn how to use self-control to make better decisions regarding your life and relationships. If you're struggling with self-control issues, talk to a therapist for a better help, and that's all. Thank you.
So occasional criminals. Occasional criminals are also called as situational criminals. These are the type of criminals who are the outcome of a sudden situation or due to a specific reason he commits crime. Such criminals suddenly meets a situation where he cannot tolerate and lose his temperament. So these occasional criminals occurs when there is a situational inducement. So they only commit those crimes and offenses which do not indicate natural criminality, or else crimes and offenses against person or property, but only under personal and social conditions, unlike from those who are committed by born and habitual criminals. So occasional criminals, so these are the type of people who only commits crime when there is an opportunity. Like for example, let's say you are passing by and then you're very hungry, you see a car, and then at the same time ang car kay wala na lock, so kanang you have there already the situation, so you will grab the situation to snatch or to commit a crime para ma-fulfill ang imong hunger. Like also for example, kanang namatay mong mama, papa, or unsa, then wala kay kwarta, and then you go there sa Colon Street and then you snatch things just to have money para lang para lang na kay panggasto. So those are the type of occasional criminals. So they are not born criminal, but they become criminal because of a certain situation. That's all. So hi, good afternoon. Next is pseudo criminals. So what is a pseudo criminal? So a pseudo criminal is, these are insane persons, and these are the type of persons who has committed crimes because of self-defense, these are not true criminals, or even if they commit crime or do something criminal, it is because of acute pressure of circumstances which leave them with no choice. So they do something or they commit a crime because they don't have any choice. Example for this is a bank representative who got money from the bank, thinking that there's a big possibility that he could just replace the money that he got from the bank. And the second one is a police officer who has been away from home and who has been in long of his mate for a very long time. So in a faraway land where he is right now, he tried to look for someone who would satisfy his longing. So it's because of that, because of his longing for his other half. That's the reason why he has committed a crime. So he is not really born criminal, but he made a crime because he has no choice, or he was pressured. That's all.
Criminals out of habit. It is one of the categorizes of occasional or situational criminals. So first, let me explain what is occasional or situational criminals. So it is a type of criminals that comprises people who commit crimes as a result of a sudden situation or occasion. Such criminals are abruptly confronted with the circumstances that they cannot endure, or they lose their temper. So especially gali if kanang gibugal-bugalan sila or something wala sila kauyon, so mao na ilang mabuhat nga ang kana nga crime. So let's proceed to criminals out of habit. So it is a person convicted of a crime who was previously convicted of a crime. So mao na ni siya ang mga habitual offender or repeater nga bisan pag magbalik-balik sila sa presinto, buhaton gihapon na nila ang crime. So ang possibilities ana is poor education during their childhood, or nagdako sila sa lugar nga daghan og criminals, or kanang mga nakita nila or gitudluan sila nga inganaon pagbuhat og crime para makakwarta baron or something kanang makapatabang sa family. Kay mao na ba yan na karon kasagaran, kay bisag bata pa kay tudluan na sa parents kung unsaon pag-commit sa crime, samot na sa kanang pagkawat. So ingana. So that would be all, and thank you.